Thank you, Madam Speaker. Next, former Chairwoman of the Congressional Black Caucus, Congresswoman Joyce Beatty.
Thank you, Madam Chair, and to the members of the Steering and Policy Committee. And let me also thank Leader Jeffries for convening us and having Democrats here doing our job.
That's right. Let's applaud that. Let's applaud that. Great.
I am here and am thankful for the opportunity to testify today on behalf of the families, seniors, and working people facing a healthcare crisis in this nation, and particularly in my 3rd congressional district, which I represent. I am a subcommittee ranking member on financial services and chair emerita of the Congressional Black Caucus. I'm here today because I have seen firsthand the impact of how economic and health insecurity go hand in hand. And I know the lapse of federal health care subsidies will leave millions of Americans at risk, including low-income families, seniors, and people of color who already face barriers to care. I want to share a story of Clara, a constituent who has multiple family members that rely on the Extended Affordable Care Act healthcare tax credits to afford the medications that they take to survive their chronic health condition. If the premiums skyrocket, they will not have the support they need for those medications and their periodic medical appointments to monitor their conditions. Medicaid isn't a handout to be thrown away with budget cuts. It's a lifeline for people fighting to stay healthy and for the safety net providers like Heart of Ohio Family Center, who serves them in my district, which is a not for profit FQHC, a federally qualified health center, which serves individuals and communities that might otherwise lack access to healthcare services. Another perspective from my district comes from a medical expert, a physician and a state senator, Dr. Beth Liston, who speaks out loudly about lives being at risk. And she also speaks out loudly against the Trump administration. She has gone on record saying, in Ohio, people are struggling. Close to 40% of children are covered by Medicaid and CHIP. Half of all babies delivered in Ohio are delivered through the Medicaid program. Our Medicaid expansion population are our highest users of mental health and addiction services at a time where we're battling suicides and overdoses. And let me finally conclude, like so many of the other members who have testified here today, and thank the Democrats for being here, for doing our job, for fighting for health care. And this is personal to me. As a former Dayton, Ohio Stillwater Hospital administrator, I watched children get the care that they needed, and they were able to do that because of affordable health care. Watching my mother in her last days before dying with cancer, watching the care that she received, and now thinking back today, what would have happened if we weren't fighting here to lower the costs, to save the cuts, and to save health care. And I think it's so important for us to know that we are in a shutdown, and we need to say it repeatedly because Republicans are in charge at the White House, in the Senate, and in the Congress. And it is their responsibility to fight for the American citizens, to fight for health care, and they are not doing their jobs. And because they will not join us to save the cuts, lower the costs, and fight for health care, we are in a shutdown. And it is so important that the American people know that they are lying to them. And where are they? They are not here, but Democrats are here fighting for the American people. So healthcare should not depend on your zip code, your race, or your income. And in my great state of Ohio, 460,000 individuals will lose health care due to the big ugly bill, and 32,000 of them live right there in my neighborhood, in my district. Democrats are fighting for you. We're fighting to save health care. No health care, no vote. Thank you, and I yield back.